Now, a man convicted of killing a Clifton nurse named Janet Evans and her daughter Jennifer back in 1996 was back in court today. Earl James Magnum claims he had inadequate representation for the first trial. An appeals court upheld that claim and ordered a retrial. Magnum was 17 at the time of the murder. Juveniles under Colorado law are rarely sentenced to life in custody. Magnum wasn't arrested until 2003 and has spent nearly 20 years in prison so far. Today in court, both sides argued over a motion to dismiss for a speedy trial. Magnum will be back in court on March 31st at 8:30 a.m. Now, on average, it costs a Mesa County Detention Center $23,000 a year to house an inmate. Right now, nearly half of all inmates in Mesa County have a substance abuse problem or mental illness. Today, I met with county leaders to find out how they plan to reduce that number while focusing on mental health.
Jail is not good for people that have mental health issues. It is not where they should be.
The pandemic isolated all of us, but for those battling mental health, it only made it worse. While deputies are trained in crisis intervention, Mesa County Sheriff Todd Rowell tells me in 2020, one individual entered the detention center 19 times. Jail is not the place to send somebody in a mental health crisis to heal. In fact, it can actually escalate the situation.
He was arrested 19 times, and that's not a crime issue. That is an inability to function in society due to mental health issues and substance abuse issues.
Mental illnesses and substance abuse are often wrapped up together. Sheriff Rowell says people with mental illnesses often choose to self-medicate with drugs or alcohol.
We got to get our heads around this. We truly do, to make sure people are housed in the place where they're more likely to get the help they need.
In 2021, Mesa County determined 49% of its inmates are on some form of antipsychotic medication.
These are people that get stabilized in our jail through our nurses back there and our behavioral health within our jail, and then they leave the jail at some point. And there's some cliffs there that I'm working on with the county commissioner, St. Mary's Hospital, on ways to correct that.
To decrease the number of people in jail with mental illnesses, it's all hands on deck.
Training for our law enforcement officers is critical. We're also looking at bringing back our co-responder program, where we have deputies that are paired with therapists who go out on calls together.
The county's mobile crisis unit is expanding, adding a transition coordinator program to get former inmates with mental illnesses from jail to their next appointment.
There'll be a warm handoff from our transition coordinator to a clinician, a case manager, or a peer coach outside of our jail, and it's going to be a robust system.
Jail is certainly not the place for them to be and can actually make things even worse. And at a cost of $23,000 per bed a year, I think we can certainly make better use of those dollars, helping people get the help they need so that they can be productive citizens.